Yeah, hello everybody. Welcome back to the show Behind the Scenes in Hell with Dr. Ron. And today with me in the studio is Dr. Omasan. And we'll be looking at project management. And he's an ex-clinician who's transitioned into project management. So we're going to be unpacking that journey today with him. Thank you so much for, you know, giving us some of your time today.
Dr. Ron. It's actually a privilege to be on your show and your podcast today.
Yeah, thank you
Oh,
very much. So let's dive into it. So where did it all start from? What was your journey in medicine? Where did you start?
So my journey in medicine is a very interesting one. It almost feels like I need to go back to how I made the decision to go into medicine. And you usually hear people tell you, oh, I had a passion for health. I wanted to help people, blah 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 blah. And that will usually be the story for most doctors.
Mm-hmm.
However, my decision to do medicine, it came down to a very logical decision. I was in secondary school thinking of what to do. Obviously, I was a science student. I could either do the engineering courses or I could do medicine because I was relatively good in all of the sciences. And my parents were a bit medicine leaning, but at the same time, they wanted me to have freedom to do what I wanted to do. And it came
Okay.
down to one decision. When I was going to write my jam, to do engineering, you needed maths, physics, chemistry, biology. To do medicine, you needed English, biology, physics, and chemistry. No math. I was very good in mathematics, but I was also relatively slow in mathematics. So I knew that if I went into jam to write maths, I might not finish. So my scores might be low. So I moved
Mm-hmm.
into engineering. So I made the easy decision to say, biology is a very straightforward subject. I'm very fast in biology. I'm just going to do biology. And that's how I ended up doing medicine. Yes, there was the whole medicine was interesting, but when it really came down to it, it was what were the subjects I was really good at, which subject I was fasting in the exam, and which one gave me the most mark, and that was biology. So that's how I ended up in medicine. Then went to medical school. It was quite a rough time, not in terms of academics, but in my resolve to continue to do medicine. Once I got into medicine, I think after my first year, I wasn't really feeling medicine. I decided to say, you know what, I'm going to pivot into the sciences, life sciences. So I actually made a decision to move into life sciences and I switched courses and I went in to do industrial chemistry. In industrial chemistry for a whole year, unknown to my father. By the time he found out, he said, no, this is not what I sent you to school for. You have to go back and you have to do this medicine that you've already started. So I had to retake the exams again and I had to go back to medicine to start all over again. So I lost 2 years. So I went back and I did medicine and I graduated from medicine. And that's my story of how I became a doctor. But then once I graduated, I did the normal youth service, was working in a hospital, in a private hospital. So prior to that, I had worked in, during my NYC youth service, I had worked in a primary healthcare center in Lagos.
Okay.
And that was the first time I was exposed to healthcare practice and healthcare provision in a community setting. So as a medical student, most of the time you will spend will be in a teaching hospital. So most of the cases you see in a teaching hospital are mostly advanced cases, textbook cases, the ones that make medicine seem interesting. But then now working in a community and working in a health center, I was really seeing like your regular everyday, malaria, chest infection, UTIs and all of that. And I began to see that there's a gap between health knowledge and health practice. A lot of people were ending up in my clinic not because they didn't know. Most of them ended up in the clinic not knowing what they needed to do to prevent the illnesses that they had.
Yeah.
So there was a gap in education. People just did things not knowing that this will be the
The
consequences,
impact, yeah.
the impact of what they were doing. So I started to think about, I think for me to make the most impact in medicine, I would rather be in the preventive side or on the preventive side than be on the curative side. So I started thinking about, I think clinical medicine is not for me. I don't think this is where the majority of people need the kind of services I think people need. And that's how I started researching about what is out there that is helping people make better choices with their health. So the other health determinants, or the other things that determine good health, other than taking a tablet, taking a prescription, and that's how I started thinking about public health. And of course, I was having conversations with people, and you could call it luck, but I found myself in a public health organization that was looking at maternal health and reproductive health. And it was because I had met a friend in NYC who was working for an NGO at the time. And she reached out to me and said, "Oh, we had a conversation one time and he said you were looking for opportunities outside of clinical medicine. This opportunity has come up. Are you interested in it?" I was like, "Well, why not? I can always come back to be a clinical practitioner. But let me see what it is on the other side of medicine where, it's public health. I'm in the community. Let me try it out for a year and see if this is what I really want to do." So I took the opportunity and I went into public health. So that was my first stint into public health, and probably what kept me in public health, because after I made that decision to go into public health, I never came back to clinical medicine. So I got in there and I started going into the communities. I think my first deployments, if I'll call it that, was in Lagos, and it was in Korodu. So I was really, really working in the heart of the community, going to do community outreaches, talking to people in the community, talking to nurses, training nurses on some health techniques, some delivery techniques. So it really made in the heart of what I really wanted to do. And for me, that was it was that passion to be able to help people make better decisions, to have better health, as against trying to cure diseases that they could have easily prevented, was for me the push that took me away from clinical medicine into public health. And once I got there, I realized that I think this is a field that I want to stay in. And I made that decision based on two reasons. One, obviously, there was a passion I wanted to help people prevent them from getting sick and all of that. But on the selfish side, if I would say that, is it was a drastic change and a shift from the life that I knew as a medical doctor. And this is just me being very honest. There were no night calls. I didn't have to sleep 24 hours. There were no weekend calls. That means I had my weekends to myself.
Yeah.
And lastly, it paid way better than the average clinician was earning in a clinical setting. So for me, those three things just made the decision very easy to continue down that line of public health. And the rest, they say, is history now. And I've never really went back to clinical medicine. That's my story, really.
So interesting. Basically, you don't miss the other side now.
I think about 5 years ago, I probably would have said I missed clinical medicine a bit. And even sometimes that I think about it now, and I see, obviously, I have friends who have gone on to be consultants. I have friends who have gone on to be plastic surgeons, general surgeons, cardiothoracic surgeons, and I see the fantastic things that they do. And sometimes I think about it and go, could have been that, It could have been me doing that surgery, But then I think about all the time I have and the time they don't have. And I say, you know what? I am very, very content in what I'm doing. I'm happy doing what I do every day. And I believe strongly that everybody has a role to play. There is a role.
Absolutely.
And there's also the role of people who make things happen so that doctors can do what they do. And I think in what I do now, I fall into that bracket of making the engine work so that doctors can do what they do. And I think we both arms need each other for the system to work. And I'm very content in where I am now. So right now, you couldn't pay me to go back to clinical medicine.
Even for $1 million. But
when you say like that, it's tempting, but I probably can make $1 million outside of clinical medicine. So I'll probably say no. 10 million, it would.
You start considering.
We'll consider it, yeah.
That's interesting. So quite an insightful journey, from where you started to where you are at the moment. Now, a common misconception people have is that sometimes these pivots are easy because some people ask me, Ronald, what's the easiest one to get into? Is it business analysis? Is it project management? Is it data this? Is it this? And I'm like, no one is actually easy, right? So looking at your journey now, I know there must have been a learning curve for you getting
Mhm.
into this space,
Yeah.
moving from medicine into public health into project management. So could you like shed more light on that?
Yeah, absolutely. So, and this is I do this thing where I try to assess what I have, where I'm going to, and what do I need to get there. So remember when I said I took my first public health job straight out of working in a primary health care, in a clinical setting. And once I go into that public health space and I realized that, okay, this is the space that I wanted to be in, there was a lot of things for me to learn. There was, the new language around how public health and practitioners, how they talk, all the acronyms, how things are
Yeah.
done, the knowledge that you needed. And I said, the best way for me to compete in this space is to get or have the knowledge that these people have. These people who are here, they've been here a while, so they have the experience, but they also have a knowledge base. And I told myself the best way to catch up with these people is to educate myself. And that's when I think 3 months into that job, I started my master's in public health. And I said, I want to be here in 3, 4 years. I can either wait to get the experience and leverage my experience to get there, or I can shorten that 4 years into 2 years and get a
Yeah.
master build and bridge that gap. So I got myself into an online long distance masters. So I was working full time and doing the masters full time. And trust me, Dr. Ron, it wasn't easy. It was one of the toughest times in my life. Going to work in the morning, coming back at night, tired, opening your laptop, knowing that you have 5 minutes to submit,
Assignments and all.
right? And don't forget, me paying from my own pocket. There was no father who was sponsoring me now. There was no mother who was saying, come and take this pocket money. Nothing. I had paid my school fees. If you don't do the exams, you don't take the test, that money is gone. So there
It's
was
gone.
no, and I think it was, and I might be wrong, but I paid, my school fees was $25,000 at the time.
Wow.
So, and I was paying instrumentally. So every money, every penny I had was going to pay my school. Yeah. And it was tough. Or I was living with my brother at the time. So I was able to save some money because I wasn't paying rent.
Right. Yeah.
So most of my money was going into paying my school fees. So just that struggle of having to go to school and work was really challenging. But something happened because it was a 2 year master's. Something happened towards the middle of my master's. We had some financial constraints on the job, so we weren't paid for about 3 or 4 months. And bear in mind, once my salary comes, I pay my school fees. So it was like I had some money saved.
Mm-hmm.
First month, no salary. I wrote the school and said, I'm having some financial challenges, blah, 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 blah. Can you give me some time? They said, okay, fine. The next month, I had to borrow money from colleagues to pay my school fees. By the third month, still no salary. I went to my boss. I'll never forget it. And I went to him and said, so he knew I was doing the master. And I went to him and said, I can't continue. There's no money. There's nothing I can do. I just can't continue. I need to drop out. And then whenever they pay us the salary, I will go back and I'll continue if I can. I can't remember all of the things he said, but he said one sentence that stopped me and that really got me thinking. He just said, Omasan, no matter what you do, not stop. I said, what do you mean? He said, find a way. Just find a way. Find somebody, I don't know how you're going to do it, but find a way to pay the next school fees. See, because I can tell you, if you stop, you will not finish. And I left him thinking, what does this guy know that I don't know? Obviously, he's a doctor. He's much older than me. He's been doing this for a while. And he's just saying,
Yeah.
say if you stop, you won't finish. I went home thinking, okay, you know what? I won't stop. I'll continue. I'll find money from somewhere. I think I ended up borrowing money from someone else, paid that third month school fees. By the fourth month, they paid us the salary that we've been owed. So we
Yeah.
obviously was a lump sum. So I, cleared up my debt
Offsets your debt. Yeah.
and I continued. I finished that master's right on time when I was supposed to finish it. And the moment I finished my master's, I'd spent 2 years on the job, gotten a master's. So in my head, I thought, I'm thinking now, yes, I have the experience. I have the certificate to back it. I'm going for a senior position.
Mhm.
So I started applying for new jobs. Obviously, the usual thank you, but,
Unfortunately.
unfortunately, went for a few interviews. So I remember one interview I went for. I went for the interview, and so I was leaving the interview. The director said, "Oh, I really like your beard. You need to tell me how you maintain it." I'm like thinking, I've struck a nerve. Yeah, yeah. We were bonding. I feel they were bonding. He likes me. I didn't get the job.
Wow.
Devastated. It's like, okay, we move on. And there's something about me when I'm looking for a job is I feel I feel deflated in the moment. But that's it doesn't last more than 10, 20 minutes. I use
Mhm.
it well to like, but
Push forward.
if you didn't give me that, someone else is gonna give me that chance. And I will make you know what you did not get when you see
Mhm.
somewhere else. So I use that to pump myself. Say, okay, you know what? Yes, we're going for the next one. Eventually I got a new job, left, and I got like I was like in my previous job, I was like a project officer in the field, running around. I got my next job was a promotion. I think I was a center manager. I was on that job for only 6 months, and it was on that job. And that's so the thing with me is that when I get into a space, I start having conversations with people on the job. I start to pick their brain on what are you doing here? Why have you been here? What are the opportunities? Excuse me, in
Yeah.
this. And I remember talking to the accountant on this new job. And that's when he said, oh, he's thinking about doing an MBA. I said, yeah, that's interesting. Why do you want to do an MBA? Oh, it's looking for like, with an MBA, you can be, the opportunities for leadership position is much more,
Yeah.
it's more, is people look at you a bit differently. They think you know what you're saying, what you're doing. So I said, okay, maybe my next step is an MBA.
Is an MBA.
Maybe my next step is an MBA because now I'm a center manager, but I wasn't satisfied. I wanted
Yeah.
more, still hungry for more. 6 months after I left that organization, joined another organization. I think I joined in July or August. By December, I was out. I think that was January of 2016. I started a new job as a state team lead. It was a project that was being sponsored by BMGF and was being run at Hopkins University. Just to give you a backstory of how I think about places I choose to work in. My choice to work in an organization is not random. I might be all over the place, but let me just tell you how I think about places I work. And this all started from the very first place I worked in when I started in public health. It was a project called Part 2. The full name is called Partnership for Transforming Health Systems. It was in the second phase of the project, and it was being funded by DFID at the time,
Okay.
Department for International Development, UK.
Yeah.
That was my first time ever hearing of DFID. Never heard of DFID before in my life. So I started doing some research. Oh, so there's DFID, there's USAID, there's the aid from Japan, I think. And then obviously I realized that those are international donors, but you also had national donors or local donors
Mhm.
time. And I just told myself, I said, if I've already come in here and I'm working for an international donor, from here onwards, I'm only going to work for international donors. I will not work for anything less. It has to be any of
International.
any of the international brands. If it's not WHO, if it's not UNICEF, if it's not DFID, if it's not USAID, I'm not working. That's where I'm going to head. I'm not doing
Uh-huh.
and not to put them down in any way, but I just
Yeah.
said that is not my line. I am just going to focus on the international space. So when I'm even looking for jobs, I'm looking for jobs with international organizations or international funded projects. So I left that organization, went to the next one. That was Mary Stopes. Mary Stopes was the Nigeria arm of the UK Mary Stopes, or the project being funded by USAID. I left that one, went to the next project, which was John Hopkins, funded by BMJ. So that's how my brain have primed my brain to think. And then I remember when I was applying for the state team lead for the John Hopkins project, one of my friends said, "That's a big leap, you know." I said, "Yes, I know, but I can do it. I've done it before. There's nothing that they're doing there that I
That
haven't
you
done.
can do.
It's just managing people and managing outcomes. I have the experience. I have the knowledge. Why can't I do it?" She said, "Okay, if that's the case, go for it." I went in. That's probably the one interview that can probably say I have been my most confident.
Mm.
I don't know if the confidence worked for me. I don't know if it didn't, but I know I walked in there. If you don't give me the job, I have another job anyway. It's not like I'm not one of the people that would resign when they don't have somewhere else to go.
Go
So
to, yeah.
in my head, I was like, I know I'm fit for this role, but if I don't get it,
No problem.
no problem. I'll go back to where I'm coming from. And I got it. And again, every time you change jobs, it's always a steep learning curve because there's a lot of things you have to learn about the organization, the culture of the organization, how they do
Yeah.
things. You have to start building new relationships again. You have to keep,
Yeah.
knowing who is who in the organization, who has the power in the organization, what relationships do you need to maintain and sustain? How do you get things done? Because everybody, works and operates differently. And just generally finding your feet and also building trust in people that you work with. So every time it's almost like you're starting again from the beginning.
Mm-hmm.
But once I've set my mind to say this is where I want to be, I put in the work and I make sure that I'm not only seen, but I'm seen to be doing what I need to do and get the result out of it. So yeah.
I mean, that's quite interesting because, I mean, I think from what you've said now, I mean, I picked a couple of things, being very strategic about what you want to do, being very clear about, maybe your game plan or how you want to figure it out, then, sort of going for that, which is really quite important because sometimes a lot of people tend to, you know, be unsure of what they want to do. I mean, to be fair, it's not everybody that usually has that clarity of thought or mindset to say, this is what I think I should do and just go for it because sometimes you just get a lot of influences here and there and you
Yeah.
keep changing your mind
Yeah.
and all of that. So that's really good. So yeah.
Just on that point. So what I do is I look at people, like I said, once I've decided this is the space I want to be in, I look at the people ahead of me and I look at what they have.
Mhm.
In my head, I tell myself, if this is what they have, it must have been this that got them to where they are. So that means I need to get what they have. So if I go in and I do research about all of these heads of organizations and I see that
Mm.
they all have a master's or they all have certain experiences, that means this is obviously something that is relevant in this space. So for me to get to where they are, which is where I want to get to, then I need to get those things or I need to do those things.
Mhm.
I don't have, for a long time, I didn't have an individual mentor, but I had mentors, I'm not called virtual mentors that I looked up to and said, if they had this, it must have helped them. Okay, I'm going to get it. I'll just go on LinkedIn, look at people's profile. Oh, they have a master's in this. Oh, they had this. Oh, they worked here. They've done this. Okay, maybe I need to do this. Maybe I need to do that. Then I start to have the conversation about what are the possibilities. If I want to do this, let's do it. If I want to do this, how can I do it? And then you're obviously going to have doubts. You're obviously going to question, do you really need to, should you, actually continue? I remember when I was doing my MBA, there was a time where I said, you know what, this MBA said, what am I going to get out of it?
Yeah.
Because I was already relatively comfortable. I was doing well. I didn't need the MBA. I could just walk myself through the ranks and get to where I'm going to. But I remember one of my colleagues asked me, she was the accountant in the office. She said, why do you put yourself through all of this stress? Why? I mean, you have an MPH, but why an MBA? Why? Why are you stressing yourself? And I looked at her that day and I said, for two reasons. One, I want to be in leadership position. I want to be able to run an organization one day. It might not be today, it might not be tomorrow, but one day I need that knowledge. And I said the second thing is I want people to know that you can do it. You don't have to have a business background to do an MBA. Anybody who has hunger for business can do an MBA. And it's not the reasons why I'm doing it. It's for me, yes, but I want people to know that it's possible. And she looked at me and said, okay. I just walked away. I was like, yeah, that's why I do what I do.
Uh-huh. That's cool. I'll take you back a bit now, because you mentioned earlier that you look at the freedom you had, the joy of being on this side, probably greater impact against other side, right? Which helped to make that decision to transition. But again, in reality, I mean, maybe it's quite different for you, but I know a lot of people who wanna, change careers or try to do something else. It's not really that easy because I think a lot of people are trapped in this sunk cost fallacy that am I gonna leave all this behind and start all over again? And when you now bring friends, relatives in the picture, they're like, why is a doctor trying to go this or that way? This is where you should be. Did you ever feel that or experience that?
So if I go back to the beginning of when I decided to do the first pivot, it was strictly a case of I didn't have so much to lose. So this is how I thought about it. I'm a doctor, I have graduated as a doctor, I have a license to practice. Continue paying my license fee, I will always have a practice to come back to. I will always be a doctor.
Definitely.
So I cannot not be a doctor. However far I go, worst case scenario, I will always be a doctor. So as a doctor, I strongly believe that we have that security, that quote unquote job security. Always, if it doesn't work elsewhere, I can always fall back to
your stethoscope.
And we dust it. I'll go back to clinic. So when I was making that first move, that was what I was thinking. I said, and it wasn't like it was a permanent job, it was actually a contract job. And they actually told us this contract is a 1-year contract. After that, everybody pack your load and go home. And I remember in the induction, they said, are you willing to take this risk and be jobless after 1 year? There were 3 of us that were recruited that during that program. And two of us were doctors, or no, 2 of us were doctors. One of us was a nurse. And we both said, yeah, we'll take the risk. So for me, I had the security knowing that if I go back after 1 year, I can go back to be a clinician. But I think for me, that just where it was difficult to make that switch was when I eventually decided to move away from public health, what I have done for the last 10 years, and then move into what I do now in terms of hospital improvement, hospital processes, process improvement, quality improvement within an acute hospital here in the UK.
Yeah.
For me, that was is this what you want to do now era? It was, okay, you built your life around this. There's so much investment that has gone into this. Are you now all of a sudden going to just abandon that life or that career and focus on this one? And I remember one of my colleagues that I had worked with previously, I remember her saying, It was years after I had switched. And she said, oh, if only you had continued in public health, probably would have been a country director now or like a regional director or something. You'd have gone far.
Yeah.
So back to your question, that was a sunk cost. That was a bit difficult for me to leave.
Mm-hmm.
But my decision to leave public health was, I think it was more a personal decision than a strategic decision. I remember when I was leaving, I told my boss and I said, I think I've come to the point where I have done as much as I wanted to do in this space. And I think it's time for me to move on to something else. I couldn't see myself making much impact than I'd already done.
Doing, yeah.
So I think I had come to the, how do you say that? I had come to the end of the line. And I was like,
Or the zenith, yeah.
I was like, I wasn't getting the fulfillment that I had initially. So I thought it was time for me to move. I could have stayed for financial reasons and I would climb up and I'll become somebody really, really good and make money out of it. But then I didn't get that fulfillment anymore. And I tell you, I think it's time for me to try something else.
Mm-hmm.
While it's easy to say that and do that, when you then move into another area where you almost have to now start all over again from the beginning, and you're now starting almost like a new career path where most people don't know you. So they see you as a quote unquote a newbie without the experience and treat you like a newbie, but then your ego is telling you that where I'm coming from, I was
Yeah.
so and so. So how do you then marry the
Marry
thing?
both.
Keep your head down and learn the new skill. Get yourself into a place in this new space where you can now be trusted and you're now seen as a thought leader in this space.
Mm-hmm.
Saying, you know what, if they don't appreciate me, I'm just going to go back to where I'm coming from. Because it's quite easy to go back to where you're coming from because they already know you there. For me, that was the challenge. I had moved away from that, but I got into the new space where nobody knew me. And there were days where I would sit down and I'll be asking myself, I'll say this in pidgin English, now maybe this.
Are you with this?
If only they knew in my past life, you can't talk to me like this. But I'll swallow it, I will take it in, and I'll say, you know what? It's all in learning phase.
Yeah.
It doesn't last long. I will get through this and I'll get to a point where I will then become the authority. And that's exactly what happened. But there's always, like he said, the sunk cost it's almost like when people, maybe this is not a good example, but you know when you're I hear people make this and they say this thing a lot where, oh, I've been dating somebody for a while, I've invested so much time in this
So
relationship.
much, yeah.
I can't just call it off. 10 years from now, you're still going to be saying, I've invested so much, I'm unhappy about it, I can't just call it off. I read a book one time in 2019. I think the book is called Second Half. I can't remember anything in the book, but the only sentence I remember in the book, the guy said, when you're faced with two decisions and you decide to go with one decision, no matter how much information you had and no matter how much analysis you do to end up with that decision, you will never know what it is that could have been with the other decision. No matter how much you thought about it, that you made the best decision given the information that you had. Once you eventually take the decision, the other decision that you did not take, you will never know what the outcome would have been. He said, once you have then taken that decision, and however far you have gone in that decision, whether it's the beginning, the middle, or towards the end, he said the moment you realize that it was the wrong decision, reverse and go back the other way that you thought was not the best at the time. Because if you continue down that road, you will never know what it means to have gone the other road. So for me, that's how I think about things. You know what? I've done this. If it's not working, if I don't like it anymore, I'm going to leave it and I'm going to try something else. Again, if I go here, it doesn't work. I pack my load, go somewhere else. Or, and I don't know how true this is, but they say you regret the things that you did not do more than the things you did. So I don't want to
Absolutely.
be 70 and say, oh, I wish I had done that, I wish I had made that move. No, I'm going to make the move. If I fail, I fail. If I don't fail, I'll continue.
Yeah.
I think it's a mind at the end of the day.
Yeah. So this leads me neatly into my next question around what are the key skills that you think clinicians have or possess that sort of make that move easier? Well, easy in quote, but maybe smooth without using the word difficult.
So I think clinicians have transferable skills that they can leverage when they're pivoting into project management. And that's because everything we do as clinicians is almost like a project. We plan your cases. First of all, you have your initial, if you do as a clinician, you know that you do your clicking. And your clicking in project management term is just basically you collecting requirements. Your client is your patient. They need a need. You go there, you talk to them, you collect them, you collect the information, and then you make a diagnosis and you present them with a solution. It's exactly the same thing in project management. You meet your client, they have a need, you ask them what their challenges are, what their pain points are, you collect that, you do all your analysis or your calculations, and you say, okay, I think this is the best solution for you. And then you plan it. You say, okay, we're going to start with this. This is where we'll end. Same thing you do with the patient. Okay, we'll give you this drug. We'll come back to clinic in 2 days or in 4 weeks, and then we'll follow you up. So it's exactly the same thing, but just how do you then think about that in a project management space?
Space, yeah.
Deadlines and multiple people to talk to or diverse stakeholders to talk to. And because we've been it's not something they teach us in school, but it's something you learn on the job. Communication is one of the key strengths that we have. We know how to and I'm assuming that we know how to translate complex medical
Jargons.
diagnoses or jargons to patients who do not understand medical jargon. So we have this ability to break down complex words or complex scenarios into easy to understand statements or scenarios for people to understand. And that's a skill you can transfer from being a clinician to being a project manager. Because 90% of what you do as a project manager is communication. You're just talking. You're talking about ideas. You're talking about challenges. You're managing conflicts. You're resolving conflicts. You're talking to stakeholders to get buy-in. You're negotiating. You're persuading people to do things. Just the way you persuade your patient to take their drugs, you're negotiating for the option to do. So you're already doing this in your day-to-day work. It's just now you're dealing with a different type of people. They are not sick. They're not desperate. They have options and they can, engage with you. So I think communication skill is a very good one that you can transfer over. Second one will be leadership skills. As clinicians, we are already trained to what with that leadership skill has been built in us even right from medical school, where from early in your medical school, I think maybe your clinicals, you're already presenting your cases to your consultant. You have that confidence and boldness to talk to senior leadership. That's something that you can bring into project management. So leadership is something that I think is very key and is that you're able to transfer. Another thing is, if you have ever worked in the government hospital before, you must know how to manage conflict because your patient is never satisfied. Your nurses or your HPs are never satisfied. You're always having to troubleshoot and problem solve. So managing conflict and problem solving is, I think, are skills that doctors have.
Yeah.
Having said that, the challenge I see most doctors have is most doctors are so, it's almost like they are pigeonholed into only saying things from a clinical lens. They do not know or do not understand what happens outside of a clinical or a medical lens. I can tell you if I ask a doctor, how do you think the NHS is funded in the UK? They have no clue.
Yeah.
So I think they need to be able to step out of their cocoon and begin to see things that are outside of the box in terms of their practice, what they do on a day to day, understanding how systems and processes work. How
Work,
do
yeah.
the patient you're seeing in front of you, how did they get to your table? What are the steps that they took? Or what steps did they have to go through to get to sitting in front of you? And how do you make that better in terms of patient experience? And this is just project management within the healthcare space. So I think leveraging your communication, your leadership skills, your problem solving skills, your negotiating skills, and then using that to see beyond what is in front of you in terms of your patient, I think is what most doctors need to be able to do that transition. Obviously, this I'm talking about doctors who want to leave clinical practice. If you're enjoying
Yeah.
clinical practice, then of course, by all means, continue in clinical practice because it's still.
I mean, for all intent and purposes, we still need people in the clinics anyway. So everybody can't leave.
Yes, yes. But I think those are the things for me. I would say are really key. And communication is 90% of project management because you're always talking to people. You're always trying to convince people. Yeah, pretty much.
So looking at your job so far, what you do at the moment, would you say being a clinician has added some sort of extra value or leverage in what you do? Because again, I mean, we see project managers who don't have any healthcare background, who don't understand maybe IT or whatever, but they do the work and they get results.
Yes.
So do you think there's a distinct advantage, being a doctor confers on you moving into this space?
Yes, it does. And you're very correct. Sure, at the moment in my team, I'm the only I'm the only person with a medical background. So most people I have seen in project management in a hospital setting usually are not clinicians. And if you're a clinician, and that's why I said it would be really good if you have clinicians who understand how the hospital works and how the hospital runs.
Yeah.
Advantage because you speak the medical term, you understand from a medical quality point of view how things can be done differently. And then because you now understand the other side, you are able to bring both of them together to make the best of what you have. Usually what you see is you have people who are in project management or who are in ops who have very operational knowledge of how things should be. And then you have clinicians who only have knowledge about how medical output and outcomes should look like. There is that disconnect between how do we then get this to talk to this so that everything becomes one seamless process. An ops person say, oh, we need to do X amount of clinics because we have X amount of patients. And you hear a doctor say, but I can't do X amount of patients in this amount of time because it impacts the quality of the care that I provide to the patients. Two very standard arguments and they are valid.
Very valid.
But the point is, you have 10,000 people who are waiting to be seen. You have one doctor who has to see 10,000 of them. The doctor cannot take the time, the whole 1 hour to see one patient because he's trying to improve quality of health. At the same time, you can't run the whole 10,000 through the doctor in 1 hour because then obviously the outcome is terrible.
Yeah.
How do we get to the middle? Only a doctor who understands the operational side of things and who understands the clinical aspect of things is in the best position to actually bring the two together. And usually you see that when you're having conversations with doctors, you can understand where they're coming from. And when you're talking to people in operations, you can understand where they're coming from. And then you can take, and from my own experience, you can then take the two valid points and find a middle ground and then present it back to each of them and say, does this make sense to you? And 9 times out of 10, it makes sense to them. So what that does for me is it takes me a shorter time to get to a solution compared to someone who has no clinical background, who is just going on and on and on about, I can't understand why you don't see it from my point of view. They can never see it from my point of view. Same way he's saying, I don't understand why you cannot see it from my point of view. They've never been there.
Yeah.
So for a doctor, you have the advantage because you've been on this side, you know how things work. And you can easily on this side and you understand how things work. So if you can bring those two together, you're at more you have more advantage over someone who doesn't have clinical experience.
Yeah.
Necessarily gets you the job, but it makes you perform better on the job.
Mm-hmm.
And you become a key person of resource within the team that people go to when they have problems.
Problems,
And
yeah.
it does for you, it makes you an indispensable member of the team.
The team.
Because no one has the skills and the experience that you have. Only you do. So worst case scenario, if somebody was to be let go, it won't be you because
It can be you.
you have a recognition of skill that nobody on the team has.
Has. Interesting. So this, I mean, while you were talking, I was just thinking about a couple of things, right? So this brings me to things around resistance to change, right? Because that's like a big issue in most of these, IT projects that happen across hospitals. And clinicians, they're like the biggest group, if I use that word, of people who resist change. I love that.
Yeah.
So again, looking at your background now as a clinician coming into this space, do you think it's had any impact in how you sort of manage change or reducing resistance to change on project?
I wouldn't say my I wouldn't say it's my background or my experience as a clinician. I would say it's just the way I think. And I think if anything, it is my experience from public health that has shaped me to think the way I think. Because in public health, things are rapidly changing and you need to change with it. You are having to work with government that policies change as the weather changes. So you need to be on your toes. So I think it's that experience that has shaped the way I think about and the way I approach change. And doctors do not usually think that way. Doctors are very much set in their ways, and I can understand that. And the reason why most doctors think that way is because once we accept things that have gone through, because we are science oriented, we accept things after they've gone through repeated trials and they've been approved to be safe.
Yeah. Yeah.
Right? People on the other side accept things before they are safe because for them on the other side, the opportunity cost to a failed system is probably financial.
Yeah.
For all the doctors, we've been so trained that once you make a mistake or something fails, the cost of your failure is a life.
It's a life, yeah.
So most doctors are very risk averse. Is the probability of it failing has been the confidence interval is 95% or 99%. Sure, I think it's almost 99.9% confidence interval. If they don't see that, they are not adopting, they are not taking it.
Yeah.
On the other side of things, probably what they need is 70% confidence interval and
They are good to go.
right? How do you get a doctor to begin to see things that way? And as a doctor in project management, you want to be able to leave that side of your practice in clinical medicine and not bring it over to public health or sorry to project management because you don't want to be seen as that cog in the wheel.
In the wheel, yeah.
Because whether we like it or not, is change that because the world is changing so rapidly and technology is changing so rapidly, we need to change with the time. If not, you'll be left behind. So I think for me, it is if I was to put on my medical hat, I would be very, very risk averse and change is something that I'll be very, very resistant to. And I'm not surprised that most doctors are resistant to change.
Change, yeah.
Yeah, it's a common thing that we see on a day-to-day basis. What I
Thank you. Yeah.
doctors want to change. They're not against the idea of change. But when it comes to the doing, that's where it's almost like you need to get beyond that inertia to get people to do things that needs to be done when you need to change things. So the attitude is what is the attitude I'll call it now? The desire is there. It's just how do you convert that desire to action? I think that's where we're missing it.
Where the barrier is.
Yeah.
So looking at your, okay, I'll probably come to this later. So one of the questions I get all the time is certifications over experience, right? Do we gone for the certifications before we start getting the experience, or do we look for the experience and now back it up with certifications? Where do you stand, or what do you think?
So that's a very interesting question. And people understand certification not in the not in correct or appropriate manner. So, and if you've ever done a PMP, and most people who have done a PMP will understand what I'm saying, you cannot write a PM, you can't get a PMP exam approved without having a project management experience. So now you ask yourself, if I'm writing a project management certification exam to have a certification, why do I need the experience to be able to exam? The certification is almost like saying, for you to graduate from medical school, you have to be a doctor first. I'm already a doctor. What do I need a certificate for?
Yeah.
However, certifications are not your regular degrees. Certification certifies that you have the experience. That's how people look at it. A certification is not the experience.
Just to acknowledge, yes, he or she has it.
You've done it for the last 3 years. I can see the work you've done, and I think you're doing it up to standard and now certified that you have the experience. So that's certification. So if you just go and you write an exam and you get a certification, you don't have the experience, it's almost, to some people, it's useless, because are you certifying? It has to be a skill for you to certify them as good in that skill.
Yeah.
So the experience comes before the certification, and that's how people should look at it. And I think PM doing it the right way, because without the experience, you can't write the exam. You literally have to have, I think, 3 years experience or so. If you have a bachelor's degree, and if you don't have a bachelor's degree, you need 5 years experience. I might be wrong, but you need a certain amount of years you would have worked, not necessarily as a project manager in title, but you have in a project management.
Within projects.
Yes, where you had to manage end to end some type of projects, whatever small that project is, and you have used the skills that you have learned anywhere you've learned it, whether it's on the job, whether it's you've taken courses, but you've applied those skills and you've seen results, and they've either failed, because not all projects will be successful, or they've been successful. But then you can now go on to say, I have the skills, I have the experience, can you certify me? Having said that, what the certification then does for you is, if you have it as opposed to someone who doesn't have it, the difference between the two of you is someone has vouched for you that you have the skills.
Yeah.
So your value and your worth is more than the person who has the skills, but nobody can vouch for them. An analogy would be, I say I have this skill. You say you have the skill. You are bold enough to put your skill and your experience on LinkedIn for people to see and validate it.
Yeah.
And I say, you know what? I have the skill, but nobody can vouch that I have this skill. So if you meet a recruiter and the recruiter says, you say you have the skill, I'm going to check. They go on LinkedIn, they see you there, you're bold enough to put it on LinkedIn. That means, yes, I can. Nobody has commented to say this person is a fake, this person is a liar. Chances are that you have that skill. So someone, in the case of LinkedIn, the public has vouched that you have that skill, because nobody has said, oh, this person is a fake. That's what certification does for you. Somebody is vouching that you have that skill, as opposed to someone who has the skill, but there's nobody that has vouched for it. Again, it's almost like saying, what referees do you have? You say you have worked here and here and here. You need a referee to be able to back what you've said. That's what certification does. A certification back you have the skill and the experience that you're putting forward to say you have. So I think that's how I look at it.
Yeah, I totally agree with you, because I mean, I think I also sort of lean towards this side that, I mean, just look for the experience. Just leave the certification first. Get the experience, then find a way to get certified.
Yeah.
Really. Then I think it makes a lot of sense that way. So looking at your day to day now, like, what's your typical day to day like in the life of a project manager?
So my day to day, let me just give you So my day-to-day can be anything and everything. My primary responsibility is working with clinicians, people in operations, people in the divisions, people in the service, in different service areas to problem solve issues that they are having, provide recommendations on how to make things better, and then help them to build or establish or initiate and execute a project around the solution that we've agreed is the best way forward. So my day-to-day would involve me having conversations with clinicians, having conversations with operational managers, having conversations with senior leaderships like, people in director level, executive level, and just having conversations around what are the challenges that we are facing either at trust level or at division level and say, okay, how do we best solve this problem? I will have to do an initial analysis, look at the problems, look at the metrics, look at the input from each of the different stakeholders, have conversation with each of them to say, this is the issue we're looking at. What do you think? What do you think? What do you think? So it's a lot of stakeholder conversation, stakeholder engagement, getting to the root of the problem. And what I usually do is we have this technique called the 5 whys, where you ask, so what do you think is the problem? Someone will tell you, and you say, okay, why do you think that's the problem? They say, this is why. You say, okay, why do you think that's the problem? They tell you why. You say, okay, why do you think that's the problem? By the time you get to the 5th why, you're close to the root problem as possible. So we use those kind of tools and techniques to be able to drill down to what exactly is the problem, because you know that once you solve the root problem, every other thing after that will just fall into place. So my day-to-day is having this kind of conversations, doing this kind of analysis, whether it's looking at the numbers that are coming out, looking at the number of patients we need to see, how many services or how many people need the service, what's the demand like, what's the supply like, doing things around like demand and capacity modeling, doing demand projections to see how many people need the service, how many people will eventually turn up at the hospital. Do we have the resources for those kind of things to handle the kind of demand that we're looking at? So it's those kind of problem solving and helping departments and divisions to be able to solve their problems is where I come in. And then I now support them to then execute projects, given the resources that we have, and see how we can get close to as we can to a solution. And I can do that with different teams, different departments on different days. I can do it. I can have these conversations with various departments at the same time. So the type of work I tend to do varies. Today I could be talking to people in theater. Tomorrow I could be talking to people in outpatient clinic. Tomorrow I could be talking to people in emergency department. It really, really varies. But the crux of it is I am more like a problem solver.
Yeah.
Go in, do an assessment, do a diagnosis, come up with what you think the problem is, design a project around it, and support your team or the team to implement the project. Long and short of the story.
So if you were to rate this clinical work, which is more difficult?
That's interesting. I would say, I wouldn't necessarily say difficult. I think from my perspective, I think this is more interesting.
Okay.
I say that because of the nature of the type of challenges that you face. So I go to work not knowing what type of challenge I'm going to get today. I could walk into the office tomorrow and I get an email saying, oh, this department is struggling with this area. Can you help them look at it? And it could be an area that I am really, really conversant with, so I know the ins and outs of it. Or it could be a service that I have no clue about. Really no clue. So I'm having to go in and do a lot of research to be able to understand what the problem is. So for me, it's that there's an excitement to, I don't know what I'm going to get today. For me, that's intriguing. If I was in clinical medicine, if you're already down, if you're a consultant or you're a resident in a particular unit, you pretty much know what you're going to get.
Yeah.
You're in cancer, you're going to get cancer patients. If you're an ONG, you know that it's going to be, if you're an OBS, you know it's pregnancy. You're going to be touching tummy from tomorrow till the day comes. It gets to a point where it becomes very monotonous in clinical medicine. I mean, there's, times when it might get interesting, but largely to an extent, you know what you're going to get when you get into the office. For me, half the time I have no clue what's going to happen. And yeah, for me, I think that's what intrigues me. And then knowing that at the end of the day, once I solve a problem, the chain reaction of impact goes all the way to improving the type of care that we provide for a patient. If I improve a process where I get more people into the hospital, it means somebody who is waiting 1 year, 2 years to see a doctor, if I can shorten that process to a year, it means I've improved the quality of their life because they've gotten a treatment much faster than they would have if I didn't step in. And that
Yeah.
has a knock-on effect not only in their life. If they are someone who provides for their family, then they can go back to work early, they can provide for their family. So knowing that even though it seems like my sphere of influence is only in the hospital, because I know the impact that it has, it still gives me that joy knowing that even though I'm not in clinical medicine, I'm still making impact on the lives of people in the community. I'm making impact in the lives of the patients that turn up to the hospital. So I think for me, it's rewarding that way to know that I'm not just doing things for doing so.
Well, fair enough. But I think some clinicians will want to argue and counter this. But
So
let's leave that for another day. So a bit on certifications again. I see you have the AWS certification. So how relevant is that for project managers, or is it something different that pushed you to get
uh,
that? Everybody's moving to cloud now. So
so I actually did the so again I'm very, I'll probably say I don't like to say, but I like to play around with knowledge. So I'm curious to know about things, and I like to know what my opportunities are in terms of if something was to happen tomorrow, what are my options? So I started, dabbling into cloud technology, looking out, because just kept seeing things around cloud technology, AWS, Microsoft, Azure, Google. I was like, what's happening in this space? So I decided to do some few courses and take the exam. And it's not, you do not need it in project management. However, no knowledge is wasted. It just means I can have conversations with anybody who is in cloud technology and I can speak their language. And if there was anything I needed to do that would involve IT people from a cloud space, I can better express myself and they can understand. So if, for example, there is tomorrow, if I go into the office tomorrow and they say, oh, this department is trying to pilot saving all their patient data in the cloud, somebody to be able to handle that project, I can have the conversation with the IT people and pass the information to the IT people, and the IT people can tell me what they can and cannot do using their
yeah,
technologies, and I will understand, and I can relay that message back to the clinicians and to the ops people to say, okay, this is what is possible, this is what is possible. I don't need to go and do additional research to try and understand what a container is, what CI/CD is,
yeah,
what's they say the code is in GitHub. I already know what that is. So
all of that. Yeah,
draw from that knowledge, have those conversations in those spaces. So I don't, and it's not like I was doing it because I knew I was going to use the information. I was doing it because I was curious. But I have seen it has helped me in how if these things do come up, then I understand how it's done. I remember one time where I was asked to do a process map for work to map out a particular service. And because in AWS, they do a lot of mapping out of processes. So I had learned how to map things. I know the softwares to use. So I just, in probably 30 minutes, I quickly put the process map together and sent it. And I remember my boss saying, oh, wow, where did you do this? So recently, my boss still said, did you do this process map yourself? I said, yeah, I did it. He said, you need to teach me. So that is a skill that I have brought when I was doing AWS, and it had nothing to do with project management. But again, no
yeah,
no knowledge is wasted. So there are things that you can draw on from AWS or any other thing that you've learned in the past, and you can apply them in whatever situation you are. So I think that's how I leverage my skills from all the things I've done. But you don't need AWS for as a project manager. No.
yeah. I totally agree with you because I remember when I used to play around with Python, SQL, a little bit of R, but even though coding is not my thing, but
Yeah.
I sort of now understand, okay, what's the coding structure, what do you need to do and all of that. So when I start working with technical guys, I speak the
Mm-hmm.
language,
Yes.
So, and I think it just makes your job easier because when they hear someone who speaks their language, things move really fast.
Absolutely.
Yeah, you don't have to start breaking things down for them to understand before people not take decision. Oh, okay, we want you to go ahead with this because, okay, yeah, I know it's a HL7 feed. Okay, yeah, that's put it in, and everybody just moves. So
Yeah. Yeah. It does help. Absolutely.
does help. That's fine. So looking at people who want to get into this space, what piece of advice would you want to give to them thinking about project management?
So I think the first thing I would want to say is I think you need to be very convinced within yourself that it's something that you want to do. You need to ask yourself. And when I talk to people who I mentor, who I coach, I always ask them, you're looking to transition. Why do you want to do project management? That's the first question. Second question is, why do you think project management in the health space is where you want to be? It doesn't have to be, doesn't have your reasons for doing it doesn't have to be deep. It doesn't have to be, oh, I want to save the world. No, it just
Yeah,
has reason that you can resonate with. It's something that you understand that you say, okay, it's enough to get me over the line, because you get to a point where you begin to question why you've left where you are and why you're doing where you are. So what you're doing now. So the first thing is, do you really want to do project management, or why do you want to do project management? Ask yourself that question, be convinced. The second thing is, if you're already a doctor, you're already in the healthcare space, you already have that going for you, you understand the system. The question now is, how do I leverage my existing skills in this new field that I want to go to? Off the back of that, how do I demonstrate that skill to a hiring manager that they can see beyond my clinical skills, what project management skills I have and I can bring on board? And what I see most people struggle with is they don't know how to describe themselves outside of the core thing that they've done. So I'll give you an
yeah,
example. If a doctor comes to an interview and they say, okay, tell us about yourself, and they start telling you about how they've treated people with, malaria, and I start there thinking, I really don't care what somebody malaria you treated in your life. How do you tell project management related experiences and skills to show that you have them, rather than telling us the core of what you've done, which is only relevant in a clinical space?
certain, yeah,
You get what I'm saying? So you first of all have to identify the skills, then you have to use the skill to tell a story that comes across as someone who wants to be in project management. That's the second thing. The third thing is you definitely need to at some point plan to get a certification. Because what it does that, again, like I said, it makes you stand out and it gives you an edge over people who don't have. And the people will say, well, I don't have a project management background. How can I just go and do a certification? A project is anything that has a start and an end date.
and yeah,
There are experiences in your work life that have had a start and an end that you were involved with. That is a project. But you just haven't seen it as a project. So you need to start thinking like a project manager and say, this thing I started in January, ended in February. How did I scope the problem? That's your scoping. How did I use the information I got from my scoping to then design what the project will look like? That's your planning. So now you're already planning. So now
mhm,
and now you're saying, okay, I've put this in place. I have this money to be able to do X, Y, Z. Okay, I'm going to buy this, I'm going to buy that, and I'm going to do this. You're already executed. So you've at some point you've been a project manager, but you just need to tell the story as a project manager and begin to understand the different, project management language to use and infuse into the conversations that you have. So I think for me, that's the beginning of anyone who wants to transit from a clinical role to a project management role. But again, it has to be a lifestyle that you're comfortable with. It has to be a lifestyle that you've agreed within yourself that this is what you want to do. For me, it was easy. I didn't want to do nights, no calls, absolutely no calls, no weekends. I needed the weekends to myself. So it was easy for me to do. And right now, I'm happy. I'm not probably not making as much money that I would have loved to make if I had gone on to be a thoracic surgeon, but nobody can pick up my time. I think that's what I tell.
Yeah,
So I tell myself to convince myself to stay where I am.
that's interesting. For those watching, I mean, you've seen all the points he's noted. I think the most important one, like you said, is just being really convinced that this is what I want to do and this is the why I want to do
Yeah.
this. Because if you don't get that right, everything just falls apart, really.
Yes. Yes. And again,
Yeah.
it doesn't. You don't have to. It's not something that you must figure out in X amount of time. Like I said, I've been doing this for the past since 2013. So that's how many years ago now? It's 15.
Uh-huh.
So I have gone through different stages of decisions that I've had to make to either continue or pivot into new areas. So, but because my vision has always been, this is where I want to go, this is where I want to end, I've had different variations of the same thing. And that's what has kept
Yeah.
me going. So I think that's what most people need to say, this is, like you said, what's the why? And you must be convinced.
Yeah. Thanks for that. So probably my last question, because I think we're past the 1 hour mark, really. So what do you wish you sort of knew? I mean, looking back now, what things would you wish you knew before making this transition that would have probably made your journey a bit easier, if I can use that word?
I think the one thing I think I look back now and said, I wish I made the transition earlier than I did. I think that's the key.
How?
Yes. I remember when I made the switch from public health to hospital processes and improvement. I remember calling my friend and said, bro, if you want to change, change now. Don't change in old age. It's not easy. So for me is I wish I had made the decision earlier to change. I would have been, I appreciate where I am now, but I also appreciate the fact that things could have been much, much different. And if I were to do it again, I will be less hesitant to take the next step when I did and how I did it. So I think for me, it's more around the timing of, because I took my time and I there was a point I got comfortable, like, oh, it's, I'm doing okay here. I don't need to change. Nothing
Yeah.
shaking me. But in hindsight, I should have made the move much, much, much earlier. So I think that's the only thing I think about. Other than that, I think I've been pretty much fulfilled in the decisions I've taken. I have enjoyed my journey so far. It's been really rewarding. It's been eye-opening. I had the opportunity to travel when I was working as a public health project manager. It was one of the best times of my life, if I'm being honest. Met loads and loads of brilliant people. And that's one thing project management does for you. It opens you up to people outside of or community, as it were. It just makes you see that there are things that happen outside of that clinical community, and you begin to interact with people that have different ideas of how the world works. So I think for me, I've really, really appreciated that, and I wouldn't give anything up for that. So, but yeah, I think for me it will just be the timing. But I've loved every aspect of how my life has ended and where I'm headed at the moment.
I think that's quite reassuring for people who sort of are thinking of making that move. Because I think one of the challenges we have, I think part of why I even do some of these podcasts, because a lot of people do not have visibility of people in these areas, what they're doing, if it's successful or not, is there a route there? Can we go there? If we go there, is it the end of the world? Is it going to work out or not? And
Yeah,
so, again, I think in this age and time with social media and all of that, so probably be easier for people to take those decisions because you can clearly see
yeah,
people who are doing that stuff. And I remember when I went for MSc Health Informatics, right? Before I made that decision, I was like, this thing sounds interesting, no? But is there anybody doing it? So I had to start searching. I found a couple of people doing PhDs and all of that. So it was until we had that conversation, I was now very convinced that, okay, this is actually viable, because I think a lot of people are just probably more conversant with the whole MBBS, do your MPH, getting NGO and, end of the world. That's where it
Yeah.
stops,
Yeah.
forgetting there are stuff like, digital health and all of those things out there. So yeah.
Yeah. It's quite interesting. So what you just said now sort of validates why I went. Remember I said initially when my colleague asked me why I did an MBA and I said I'm doing it. One of the reasons is because I want people to see that it can be done. What you just said now just validated that statement, because you said you had to go search for people who have done it. And once you saw them and you had this conversation, you were convinced. I wanted to be that person that people would search and say, a doctor can have an MBA, can have an MBA and do something different other than doing clinical. So I think if I would take anything from this podcast is that if you have done that, means someone somewhere out there has looked me up and said, if they are doing it, I can do it. And then they've gone to do it and probably do it better than I have. And I think that's enough reward that I would ever need, really.
So I remember even, people still reach out to me and send me DMs like, I'm looking at doing health informatics, so I can see you've done health informatics. Okay, what's actually happening in the space? What do you actually do there? Are you comfortable? Are you fulfilled? Are you satisfied? Is it tough? Is it, by the time we finish having that conversation, I'm like, they've paid school fees, they've started,
Yeah.
so
Yes, it's
that's
fine.
quite interesting. Let me see. Yeah, that's it. So, we could probably keep on talking, but just conscious of time. So, if you're watching, I hope you sort of picked up one or two things from this conversation, really. And if you're looking to pivots, it's not all doom and gloom over this side. It's just basically understanding your why. Why do you want to do this? Because you're trying to follow herd mentality. Everybody's doing this, so we all, move over. I remember somebody reached out to me that he was trying to get into project management. I think he registered for a boot camp or something. So I think after like 3 weeks, so I was checking on the guy, Alpha, how are you guys progressing? It was like he's registering for Plab 1 now. That he has seen this is not his thing, that this is not for him, that we can continue what we are doing. He's going back to the clinics.
And that's absolutely, in fact, I swear that's it.
Which is absolutely very fine.
You try. If it doesn't work for you, like I said, I went in thinking, if it doesn't work for me, I have to, my certificate and stethoscope is still there. I will go back.
It's still there.
So, absolutely. Right, yeah.
Yeah, I had a good laugh. I was like, well, it's good you've seen, what we do here, and you made that decision that, look, this is not really, my stuff, really. And going back to, where you think you can excel, like you said, which is absolutely, very fine. So we still need people in the clinics anyway. So when I get sick, somebody has to look after me. So it's been an absolute pleasure speaking with you, and thank you for making out some of your time. If you're watching, guys, so you can check him up on LinkedIn. How can we reach out to you? I know a lot of people keep asking for mentorship, coaching, guidance. How can we get across to you?
So, first of all, I think it's been fantastic talking to you, and I'm very, when you reached out to me a couple of weeks ago, I was like, yeah, this is a fantastic opportunity, and I would definitely jump on it. So, yes, thank you for having me. It's been really, really nice talking to you, just, bouncing thoughts and ideas back and forth. I'm on LinkedIn, and my name is Omasan Edon at LinkedIn. Pretty much straightforward. If anyone wants to reach out to me on LinkedIn. I have a link on my bio that you can set up a one-on-one with me if you wanted to discuss anything from career in the NHS to project management, anything really that you think I can help with. So just go on my bio, follow me on LinkedIn, and just book a time with me, usually on Saturdays and Sundays. Yes.
All right, guys, you heard it. So please don't bombard him because he
Right.
also has a 9 to 5, and I mean, just take it easy, really. So I'll see you guys in the next episode. Thanks and bye for now.